All right, now let's take a look at our special segment, Health Matters. The Democratic Republic of Congo battles with the fastest growing Ebola outbreak on record, with more than 3,800 cases and over 1,700 deaths reported since the pandemic was declared in May. While health officials say the Bundibugyo strain has spread across multiple provinces, while experimental vaccines and treatments being rushed into clinical trials. The outbreak is heavily concentrated in the eastern province of Ituri, which accounts for nearly 90% of all cases.
We don't like the trajectory of this outbreak, and it's already the second largest outbreak in the world. But if we take a photo after 14 weeks of declaration, it's the biggest outbreak, 7 times more than the West African outbreak. We cannot continue like that.
With no approved vaccines or medicines available for the Bundibugyo strain, the World Health Organization has fast-tracked clinical trials of experimental treatments. Canada has authorized the Phase 1 clinical trial of Moderna's experimental mRNA vaccine targeting the Bundibugyo strain of Ebola. The country becomes only the second after the United Kingdom to approve human testing of a vaccine specifically designed for this variant. The clinical trial will test the vaccine's safety, dosage range and possible side effects in healthy volunteers. According to health officials, the response has already been hindered by armed conflict, attacks on health centers, disruption among communities and a major funding shortfall. The failure to identify patient zero and the movement of people through conflict zones have further complicated containment efforts. More than 100 healthcare workers have been affected since the outbreak began, and frontline staff in hard-hit towns protested over unpaid salaries and dangerous working conditions, warning of further industrial action. Now it remains unclear whether the outbreak will reach its peak even as new treatment centers open and testing capacity expands. The WHO and Africa CDC warn that without stronger surveillance and community trust, the epidemic will only continue to grow.